GIZ has implemented the health insurance system for the poor, RSBY, many years ago, 2008. Can you briefly give me an overview on what RSBY is all about?
Yes. So RSBY was implemented in 2008 by Ministry of Labour and Employment, where we were supporting them since the beginning in the design and implementation. It's a basically health insurance scheme for poor, where they get a cover of roughly $500 per family per year for a family of 5 members. And since 2015, the scheme's implementation got shifted to Ministry of Health. And GIZ, as the main partner for the scheme, also shifted our support from Ministry of Labour to Ministry of Health. And now Ministry of Health is implementing the scheme. Currently, the scheme is operational in around 15 to 16 states, covering roughly 3.6 crore, which is 36 million families, and 120 to 130 million individuals which are covered under the scheme, and around 9,000 hospitals are empaneled under the scheme. So every beneficiary gets a biometric smart card. They can use this smart card and go any hospital across the country to get free treatment. And from this smart card, they have biometrics, so nobody else can use the card to get the treatment. And also it can work without internet in the rural areas where there is no internet connectivity. So that's how the scheme works. And currently the scheme is in a redesign phase where government is redesigning RSBY, and a new scheme is coming up which will replace RSBY. So this will be a bigger and a more covered scheme with a higher coverage, and that is how we are planning it. So most probably by next year sometime this new scheme will come, which will be a successor of RSBY. However, the basic approach will remain same, that governments provide a health insurance for poor and vulnerable families where they don't have to pay the premium. Government pays premium on their behalf, and they can get free treatment in any impaneled public or private hospital.
I was informed that RSBY was extended to senior citizens, that there is this so-called senior citizen health insurance scheme. Since this is a topic of my research here, could you briefly explain what the senior citizen health insurance scheme is about?
Yes, you have been informed correctly that there is a senior citizen health insurance scheme which started its implementation last year, 2016, 1st of April. And this senior citizen scheme is basically for the senior citizens who are covered under RSBY families. So it's a targeted scheme only for such family members who are already enrolled in RSBY but who are 60 years and above. They are covered. They get an extra cover of rupees 30,000, which is $500 per senior citizen per year, which means that if in a family there are 2 senior citizens, they get 60,000 rupee cover, which is $1,000. And this cover can be used by all the senior citizens in the family. So first, a senior citizen has to use their own cover. If that is finished, then they can also use the RSBY cover of 30,000 anyway, which was available to them earlier. So this scheme, since it started last year, as of now around 8 states are implementing the scheme, and more will join in this year and next year. And the senior citizen scheme is basically to take care of special needs of the senior citizen, because with cover of only 30,000 RSBY, it was not sufficient for a lot of treatment for senior citizen. So we hope that this will help 2 ways. One, more senior citizens will be enrolled in RSBY because they see now there is a more attractive package. And second, more utilization by the senior citizen in terms of getting hospitalization services. As of now, it's a very new scheme, so we don't have much data on the performance of the scheme, but the way it is going forward, it looks fine.
Senior citizens are not the main target group of the Ministry of Health or the Ministry of Labour and Social Justice, so this is a topic which might be of importance in the future. Jain, how would you describe the state of elderly care in India in general?
Yeah, you're right that for Ministry of Health, every citizen is the target. So not only senior citizen. We have a separate ministry called Ministry of Social Justice. Their main role is to look after the senior citizens. However, one thing which we feel we can improve in India is to have a more broader vision that how senior citizens can be provided appropriate care, not only in terms of health, but also pension, also in terms of other things which are needed. And since in India, the system of senior citizen care is very restricted, where we don't have too many old age homes where they can go and stay and get proper care. Mostly they live with the family, and if the family is good, they take care of senior citizen. If there's a problem in the family, then they are at the mercy of anybody who is out there. So that is why I feel in India, there is a huge need to actually improve the way senior citizens are being treated, to actually look senior citizens as a more defined category of population for which specific inputs are needed, for which specific categories are needed, and for which actually we can have more focused strategy with a broader vision of a long term, that where do we want to go in next 2 years, 3 years, 5 years. So I hope that government will actually work towards it, and ministries will work together, not parallel to each other.
Thank you very much.
Thank you.